Hey, folks, we have a wonderful, wonderful human being here and a researcher. He's world-renowned for something called expressive writing, and we have Dr. James Pennebaker here. Dr. Pennebaker, thank you so much for joining us. So one of the things most people don't know, and I shared this with Dr. Pennebaker, and I don't even know if my mom knows this. Now I'm thinking about it. So, sorry, Mom. So let me share this with you. When Dr. Pennebaker and viewers here, is when I lost my brother. His name was Colin. Wonderful, just wonderful guy. And he was 18. I think he just turned 19. I think it was my second year at Santa Clara. I was in school, and we had lost him. And that month or that semester, I was taking a class in psychology. And after the death of my brother, he was about 1,000 feet away from the home, and it was a tragic death. He fell asleep and ran across the road as he came around the corner. But the most important detail here with his death was that I started to fall apart and couldn't concentrate in class. And I'm one of those guys that I don't take a licking for nothing. I keep on ticking. And I tried my best to push through this, but something started to happen. I started to have restless nights. I started to break down. I started to have anger outbursts at the smallest things in traffic. I remember waiting in line and just losing it. And I thought, what is this? This is not me. And everyone in my family was grieving, of course, my mom and dad. And for whatever reason, that day I decided to go to class. And my professor then was talking about this fellow named James Pennebaker. And he started to talk about how something called expressive writing can shift someone's emotions, can release it, and he even spoke about what got me was the biology, because I was big onto the biology. And I started to listen in, and I basically had no clear instructions except what the instructor told me was, don't write more than 20 minutes, something to that effect. I remember hearing 10, 20. I just basically wrote until I decided to, but I wrote for 4 consecutive days, taking breaks in between my writing. I did not know why. It was just intuitively, it was exhausting. And something shifted, and I know it's ridiculous, but something shifted within 2 weeks inside of me. I started sleeping. I started feeling like myself again. And then I realized, I looked around my family, they were still grieving. I was grieving, but I wasn't drunk in it. I wasn't stuck in it. So with that official long-winded introductory, Dr. Pennebaker, it's a sincere, heartfelt thank you to you and the work that you've done. Welcome, Dr. James Pennebaker.
Thank you so much, Leslie. And I should also say, you had mentioned that you told me this story last time we spoke, yeah. And I was and I am so touched by it. It's one of these things that hearing stories like this, it just makes me so grateful that I came across this and that it's had the impact
yeah.
it has.
And if you only knew how many, now that I'm a licensed psychologist, I specialize in pain management, my patients know you very directly and intimately because I don't share the story, but now it's out. But now they'll really know why I'm very big on expressive writing, not because it's some lightweight foo-foo psychobabble, but there's science behind it. So let's get into it. Let's do the exciting part. I love hearing how did you get started in this? Because when I first read and even talked to you, I thought, there was this profound shift where, something from the sky fell and you said, this is what I'm going to research. How did you bump into expressive writing versus studying some other social aspect? Tell us, please.
So it's important to appreciate that I come from, I went to college planning to go to law school. I majored in every semester. My junior year, I came across an introductory psychology book and read it and thought, wow, this is exactly what I wanted to do. But I was interested in social psychology. Went to graduate school in social psychology, never took a clinical course. I was a little suspicious of those clinicians. They were just a little too touchy-feely for me. And and then, but I was interested in mind-body problems. And I started off studying physical symptoms, and I was writing a book, and one thing led to another, and I started to discover that people who were keeping really big secrets had lots of health problems and lots of symptoms. And uh, and I became fascinated by this. I did what ended up being a national survey, not a good national survey, but a big one. But I discovered that people who'd had major traumatic experiences that they didn't talk about were more likely to be diagnosed with cancer, high blood pressure, colds, flus, major problems, minor problems. And I became interested in this. Why is a secret so unhealthy? And um, it was particularly apparent in people who had had traumatic sexual experiences.
Mm.
They couldn't talk to anybody. And I had one case, a woman I interviewed who talked about this experience when she was young, that her mother had divorced her father when she was about 2 years old, and the mother then remarried when she was about 12. And she'd never seen her mother so happy. And a year or two into that marriage, so now she was about 14, she woke up in the middle of the night, and the stepfather, who was drunk, was pawing her and
Wow.
starting to molest her. And she didn't know what to do. She knew if she told her mother it would break her heart, so she didn't say anything. And this started to happen night after night. And she couldn't tell her friends at school because they would never understand it. And so by keeping it secret, she was essentially pushing her mother away from her friends away from her, and she was becoming more and more isolated. And I started to realize that keeping this secret isolates you. Even though you're around people, you just can't connect with them. And what's this? All of this started to make me wonder, what if we had people come into the lab and just write about or talk about this major life events that they've kept secret or they haven't talked to others about in detail. And at this time, I started to talk to clinical psychologists for the first time. I was doing these case studies, and I'd had my own experience of, I've been married a very, very long time, but even if you've been married a very, very long time, all marriages, all relationships have up and downs, and especially early on, those ups are fabulous, the downs are horrible. Now the roller coaster is much smoother. But I remember early on getting into a very serious fight about some fundamental marriage issues with my wife, and going in and just spontaneously starting to write about it, what's going on and so forth. And I was amazed how different I felt afterwards. Anyway, this was several years before I started to do the first writing study. So the idea was, well, clearly holding things back is bad for you for all these different reasons. But maybe just writing about it could make a difference. And so I did a study just to see if that was true. And the first study, we had people, they came in, and by a flip of the coin, they were asked to either write about the most traumatic experience they've had that they haven't talked much about to anybody, or they were asked to write about superficial topics. And I had people write for 4 times, once a day for 15 minutes in the laboratory. And the study worked. And in that study, we asked people we got permission from them to track how many times they went to the student health center for illness in the months before the writing and in the months afterwards. In that study, we found that those people who wrote about these traumatic experiences ended up going to the doctor at about half the rate as people.
Wow, that is amazing.
And so that was the first study. And then our second study we did a year later, and this time we drew blood and we analyzed, looked for immune system changes. And I was working with some psychoimmunologists at the time. and we got immune changes and also doctor changes. And then this thing just started growing. Other labs started to do this expressive writing, and it just started to build. It's moved beyond college students who have started working with real people and people in different cultures and people with very different kinds of problems. And it's now a very well established phenomenon. So
It really is. I love how that just kind of blossomed, and this is a phenomenon that just kind of took life. And I love how it just weaved into your life. I chuckle about the clinical psychologist part, so I'm with you on that part. So, and what's really amazing is the fact that you start to pull in biology. A lot of our psychology work sometimes does need that, and we're doing more of that with brain studies and more biological studies, because the public sometimes and also medical professions look at psychology as something unique and separate from who we are. And it's kind of our software that runs this, and that software that runs this, if it's a threat, it does impact all our biological systems. And I love the fact that you helped us find that. And I will tell you, that day when I sat in class, that was what I said, how's it possible? And mind you, just to share with you, I was not interested in becoming a psychologist. I was not. I was looking at more of the biological sciences, and so I wanted something solid, but it was that immunological stuff that I'm like, I actually remember looking up, and they said, what did he say? And I asked the professor to repeat that. And he had this huge slide and this paper that someone was doing, and that's when I started to get interested in it. And then I started to read more about it. So this is where, being a pain psychologist, it is part of our protocol, at least as part of my treatment protocol. Some of the big gurus, like in pain management, from Howard Schubert and David Hanscom, all these big wigs who are teaching pain management, or I should say pain recovery, to help people recover from their pain, to calm their nervous system down. They're doing expressive writing as part of the treatment plan for patients. So what's really intriguing, could you tell us a little bit more about the do's and don'ts, now that we know there's science behind this? And so I've got a couple of questions from my patients, and they asked, and one of the big things, could you tell us, do we write in the morning, first thing in the morning, kind of like I meditate in the morning, is that the best time to do it? So the do's and don'ts, the timelines, and also if you get somewhere along the line, just let us know if I was bilingual, maybe second generation, something like that, or third generation, but I'm speaking another language and I'm fluent in both. Could you guide us on that? Because I wanted to add a cultural factor to this, because many of my patients come from different walks of life. Could you talk to that, please?
sure. Let me start off kind of the bigger picture here. What's been interesting for me in terms of expressive writing is when I started off, I had absolutely no idea what I was doing. I just had this intuition that writing could be good for you. And intuitively, it seemed like writing more times than just once would probably make sense.
Mm-hmm.
I had people write 4 times for 15 minutes a time because I wanted to run the entire study in 5 days. The first day, people filled out questionnaires. The second, then that would give me Tuesday through Friday for them to write. And I was only able to get enough rooms where people could write in the late afternoon. So if I calculated, if I started at 4 in the afternoon and ran people, in this way, in an assembly line way, I could be finished by 9 or 10 at night. Wow. And each person would write, I calculated how many rooms, I have this many rooms, I have these many people helping me, I have this and this. And I calculated that I could get, there'd be enough time for them to write 15 minutes. The study worked. Wow. Now, in other words, I was not, okay, it's got to be 15 minutes. And then the next time I did it, I thought, well, if I start this way and start on Sunday, I could add another 5 minutes. They could write 20 minutes. Here's the reality. There is not one true way. I've been asked over and over again, I want to get a certificate in writing. And I say, there is not. There isn't one. Well, what's the true way to do it? There's not a true way. Let me start off by saying, you are the expert. You are your own scientist. Find out what works. I am not going to tell you one true way, because there is no one true way, and what might work today might not work tomorrow.
Got it.
There have been lots and lots of studies on this by me and by others, mostly others now. And I can tell you what has been shown to work on average, but it doesn't apply to you. So you, and I've always been a big believer in this, and this comes from Carl Rogers, a Rogerian approach to psychotherapy. You are responsible. You are responsible for your own problems. You got yourself into them, maybe not by choice, but you are the one who's going to have to be responsible to fight your way out.
Wow, powerful.
So what do we know? How many times should you write? I don't know. Why did I have people write 4 times? Well, I told you. But one thing I wanted this to be something that you would take in as a life course correction.
Wow.
In other words, when I hear about journaling or diary writing, I just get depressed. I get depressed because I don't want to write every day the rest of my life, because I know I won't do it. So the issue is, for me, if I'm having problems with my spouse, if I'm having troubles at work, I'm going to go on the assumption they're not going to go on forever, because if they do, that is very bad.
Right. Wonderful.
I have a problem now, and I want the problem fixed. And once it's fixed, I don't want to do more writing. To me, writing is work. Writing is trying to understand something that's really painful and difficult. And once it's over, adios. I don't need to write anymore. If life is going well, I don't need to work through that. I'm just going to enjoy it. So to me, I started off having people write 4 times, and that worked. And then I wanted to make it shorter, so I had them write 3 times instead of 4 times. That worked. I had them write 15 minutes. That worked. 20 minutes. That worked. 30 minutes. That worked. And then we started playing with other methods, and other labs started playing with other methods. So one group at the University of Missouri had people write 5 minutes. Worked. And we've had people write 10 minutes, and then they take a 10-minute break, and then 10 minutes again, a 10-minute break, and then 10 minutes yet again. All of them seem to be beneficial. Experiment. See what works best with you.
I love those words of wisdom and what you just said. A couple of things just to recap, that we really are, whether it was our choice, the problem happened, we have some sense of accountability. I love that part. And also, I think you just wiped out 5 questions I was going to ask you. But that's the beauty in this, is you've been doing this for so long, and like it or not, you are the foremost world-renowned expert on this. But I love what you did. You gave it back to us. You said, listen here, buddy, you're responsible for this. You can write as long as you want. And that is the beauty of what I did when I was going through my grieving process with my brother loss. I wrote what felt right. And I remember taking breaks and going back. And maybe I wrote maybe once a day, twice a day. And then I came to writing maybe once or twice a week if something bothered me, and I couldn't sleep. I just got up and did that. Now, along the way you said, it doesn't matter if it's 5 minutes, 10 minutes. One of the things, David Hanscom is a surgeon who does, pain recovery work now. He teaches people about pain and how to deal with it and how to resolve it. One of the things we both do that we have in common is we carry sometimes sticky notes. And I know it sounds ridiculous, but this is the wonderful part. I'm sharing this with you and I've told this to my patients. if I'm in between patients and I'm still hung up about something, or just got out of a meeting with my boss or something like that, and something is rubbing me the wrong way, I'm trying to use my mind-body techniques, breathing, just feeling. Sometimes I need to get some distance from that thought. I'll crack up that little sticky sheet and I carry it with me frequently. I'll just kind of make circles. And as I'm talking about it, so it's not beautiful penmanship, and then I rip it up and I have this sense of, so you're speaking the truth, is that as we really know what to do, just do the work. I
You know,
love that.
it's funny. I was talking to a person who heard on hypnosis, and he
Mm,
said that some hypnotists will, before they start a session, they'll have the person write down what's on their mind right then, and then tear up what they've written, because he finds that when he does that, and when these other people do it, it clears their mind. So it's the same general idea that you're using.
yeah, that's wonderful. And tell us some more then. So these are the do's and don'ts, and I love, and basically you're saying is we have that full authority to do as much as do little. And I also love your real clear distinction, and because sometimes people mistake journaling for expressive writing, and that everyday writing, you're right about that. I find it very powerful from time to time when something does bug me, when I'm feeling a lot of pressure to get some deadlines done, and just kind of picking it up and just doing it, as opposed to every single day, Dear Diary. Now, and for those of you who write out there, I'm not knocking journaling, that works for you so great, as Dr. Pennebaker's saying, but when we have things that we're hung up on that's stealing our sense of peace and joy, to get some sense of separation from it and to release it, is really important. In trauma therapy, I'm a trauma-informed therapist, as Porges called me that. So Stephen Porges. And one of the things that Peter Levine, Stephen Porges, we talk about allowing the emotion to process through us and then releasing it, as opposed to having it stuck. So you're really speaking to a variety of worlds, from medicine to psychology to trauma stuff. So it's amazing. That's very helpful. So.
Mm-hmm. It, it's interesting, the metaphor that you use about getting rid of the emotion. I don't think of it that way. I think of it more as understanding the event. So let's say that you've had real tension with somebody you're working with, and this is really just messing up your life. It makes so you don't want to go into work.
Mm-hmm.
One of the issues is if you write, what hopefully writing will do is it will turn the mirror on you as opposed to the other person. In other words, you have
Gotcha.
to ask the question, why am I so upset about this? What is it about this
Mm-hmm.
experience? Why there's something deeper that I'm responding to. Why is that? And so you start writing, and if you're lucky, at some point you go, oh, wow, this is the same thing that happened with my parents, in dealing
Right.
with them, and this or that, the other. And once you understand it, the emotion just goes away. It's not that you're pushing the emotion out. It's just
Right.
that your brain and body don't need that emotion anymore. And now you can move on.
It no longer serves that purpose. Right.
That's
Yeah.
right.
No, absolutely. And believe me, I don't tell my patients to push thoughts away and emotions. One of the things we talk about is being able to acknowledge what's there, and through writing or even any form of meditation for that matter, is to allow that to release from you. Because just like you said, so I'm an ACT psychologist, ACT therapist, acceptance commitment therapy. And we teach patients that reality is the emotions are there for a reason, much like what you said. The goal is to get some distance to be able to have some insight, right? Like, what is that about? I love how you said it was basically, if we take the mirror, and so this writing thing allows us to reflect on what's there. I've actually had several patients say exactly that. So the truth is exactly what you're saying. They've actually discovered that this is, as we call it, maybe countertransference in psychology. They recognize that their boss is like, hey, this is dad that used to kind of hyper criticize me. And wow, my boss is my dad. And so they start to recognize that, and it's almost like they have an epiphany, like you said,
Yeah.
and they recognize that what they're dealing with, and they can regulate themselves. So beautiful. Wow.
Yeah, yeah. And one other thing, other aspect of this is, don't think that writing is a panacea. It's not.
Mm.
There are times, so I
Mm-hmm.
write, I write maybe once or twice a year it's often when I'm having trouble sleeping or I'm tossing and turning about something. And very often I'll just get up, write for a while, and then get
Love it.
bored with it and sleep. But there are times when I've started writing and afterwards I realize it didn't do any good. Well, let it go. If writing isn't working for you, if
Mm-hmm.
you afterwards you feel bad, though you didn't accomplish anything, try something else. Go jogging. Go, talk to a therapist. Pray. Try other things. Again,
Love that.
you are your own psychologist, and so that's one reason, by the way, why I always prefer writing a fixed number of times, because if you write too much, it's almost like you become navel gazing. You start just
Mm.
picking at a scab, and you can
Yes.
always find miserable things about how you were unjustly treated, and you can make things worse. And that's the definition of depression, which is ruminating. And you don't want writing to turn into ruminating. You're the approach, I think, needs to be more a problem solving one, which is, why am I reacting this way? Why am I feeling this way? How is it related to other issues that have gone on in my life? How is it
Mm.
related to um, who I want to be, or who I've been in the past, or who I am now? But really, again, as you're saying, standing back and looking at this to get a better understanding.
Yeah, I love what you just said there is, thank you for mentioning that, because I think I love the fact you're probably one of the most humble, famous individuals I know that you say, listen, if this is not working, move on to something else, because it is not a panacea, it's not an elixir. And that's one of the things we do in the pain recovery program. We try to teach patients that, look, that it needs to be multimodal. There needs to be some meditation, exercising, just to kind of, and to steal from Stephen Porges, there needs to be, to help patients understand a physiological state shift. And if something is not working, then we choose something else. And I love that. And that's a very profound thing you said, because that basically makes it clear that you have the permission to put this down. And I have a lot of patients with trauma and physical pain. I work with a lot of veterans too, sometimes police officers and people in very volatile work occupations, including nurses and ED. And with the COVID, one of the things I've noticed is that when the writing, and if you can just speak a little bit to it, and then I want to get to the bilingual part, if you can do that. So I wanted to have you comment on this, is that a lot of my patients, when they have childhood trauma or adversive childhood experiences, or work experiences, like let's just say a police officer in a shooting, or firefighter, or nurse, seeing a body that's really damaged, I've told them, and guide us on this, is when you feel flooded, where you're feeling numb from writing, stop at that point. Stop at that point, get up, move, just kind of get outdoors, do a shift. Can you speak to the trauma in writing? What happens? What are your recommendations when you start feeling numbness, or you're feeling worse as you're writing it? What do you recommend, tips and tricks there?
So I have several things that I recommend occasionally. One of them is, if you're writing, you should be also paying attention to how you feel as you're writing. If you feel
Beautiful.
as though you're starting to go down a rabbit hole, if you start feeling as though you're going someplace that you don't want to go, stop. You don't need to. You can you can and should stop anytime.
Yeah.
If you feel as though something beneficial for you, go for it. In other words, you have to pay attention to yourself and ask yourself, is this something that's good for me? And you can push yourself a little bit, but there's sometimes what I worry about the most is if somebody has spoken to a therapist or a friend or whatever, and they said, okay, you've had this thing, you need to write. And so you take
Yes.
it like medicine. And so you start writing, you think, I hate this. This is not going to do me any good. And you start, and you think, this is really bad for me. I shouldn't do it. But they told me to write. Don't write. Listen to yourself. Ignore those other voices. Is this beneficial for you? Now this gets to another issue and gets to a couple of the questions that you've asked me. How should you write? First of all, should you type it? Should you write it out longhand? Whatever, doesn't matter to me. What are you most comfortable with? Okay. Turns out I thought I had discovered it, but clearly some other people have too. I call it finger writing. So
Yes.
a few years ago, maybe 10 or 15 years ago, my wife and I were we were visiting, going to different places in Europe, and we were staying in a kind of small hotel in a small room, and something was bugging me, and I thought I'd get up in the middle of the night and write, but there's no place to write, and if I turned on the light, my wife would have gotten up, and I just wanted to write. So in the dark, I just sat in a chair and started writing with my fingers. And I was amazed, thinking, wow, this really is great. And I've since had hundreds of people do this, and they report that it's as beneficial as writing by hand. Now, some people don't like it, some people love it. And one of the interesting things is I've asked people, is there any difference in their writing? And a lot of them say, well, I notice I swear a lot more when I'm writing with my finger than if it's on paper.
That's
And there's
great.
another issue that I think real, which is, what do you do with your writing when you're finished?
Right.
It's kind of
That was
hard because that what you've created is you. That is part of you. And most people, the thought of throwing it away, they just think, oh my gosh, I don't want to throw it away. But the reality is, if some other people see it, it could be damning. It could hurt your reputation. It could hurt their feelings. There are all sorts of downsides. So I recommend to people, when they start, plan to throw this away when you're finished. Most people don't, but put it in some really secure place that only you have access to it, because what you're writing is deeply personal, and it's also potentially threatening to others.
right. I've heard you talk. I can't remember whether it was at Apple or somewhere where you were talking. Give this big. You paused at one moment, and you had mentioned, and I think you've done this in your books. You had mentioned this is therapist, and I train therapists and psychologists, and we have this thing of saying is write it and bring it in and discuss it with me. And sometimes, as some of my colleagues have said, is no, this is my therapy. And I asked, how did it go? And the first time I did that, some 16 years ago, and I was trying not to react, but I was reacting because the patient looked at me, and I learned real fast is this is so personal that it's important not to have them regurgitate it to me. It's their set, it's their, like you said, their accountability, it's their energy, it's their emotion, and it's so personal. Did I hear you correctly? Therapist.
Yes. In fact, what I typically recommend is, for a therapist, is, yes, encourage your clients to write, but then have them come back in, but don't have them give you what they wrote. Have them tell you about what they've written, and that way they can censor it as need be. And if they see you with horror, they will change the story a little bit.
Yes.
Who cares if they change their story, because they have written about the issues that are important to them, and that, to me, is really critical.
Yeah. I
And we
think
can
yeah. No, please go ahead.
I was going to say, this is actually relevant to writing in, by the way, writing, whether it's finger writing, whatever, it's all the same. I also think just talking into a tape recorder or talking out loud can be beneficial as well. The reason I prefer writing is that it's slower. And I think with speaking, it means that you are processing information more quickly and sometimes more superficially. And
Right.
writing slows the process down. Now, this ties into, what if you're bilingual or bilingual? What language should you write in? One of my graduate students, Young Suk Kim, who's now a very well-known clinician, has did her dissertation where she had people write either in, she got people who were bilingual Spanish English or Korean English.
Wow.
She had them write either for 4 days in English only, in their native language only, or flipping back and forth. So one day would be for the Spanish speakers, Spanish, the next day English, and so forth, and the same thing for the Koreans. And she found a slight benefit for people who flipped between languages. So, and what people tell us is that when they write one day, say in Spanish, and the next day in English and Spanish and so forth, is that by writing in the different language, it forces a different perspective. And one of the things that our research shows is perspective shifts are really helpful. Looking at the same problem from different perspectives is beneficial. So if you have that ability to write in another language, try it out and see if it works. The same thing, some people, been some therapeutic approaches. Lucia Cappuccioni used to, and she still talks about writing with your non-dominant hand. For most people, your left hand.
I was going to ask you about that because I've heard people speak about it.
Yeah, and and I've tried it myself. Doesn't do anything for me except make me look like I'm an idiot. But some people really find it beneficial. Again, it's free.
Yeah.
Try it, and that's true. Again, all of these methods, experiment and see what works. Another one is I went through a period experimenting typing with the screen off, so I couldn't see what I was typing.
Oh wow, that's a great idea.
And it's a challenge, but some people find that beneficial. I did not find that beneficial for me, but again, experiment. And that's what's so nice about all of this.
I think you're right. And what you've left us with is, these are some pearls, because now that I'm speaking to you, it's almost like I've read, I think, 100 meta-analysis papers. And really, you just summarized multiple books and people's studies that they've taken beyond what you've done. And you've just summarized it. And I love, you keep coming back to, we are the authority of our emotions, and we have this ownership. For a social psychologist and someone who's world renowned as you sound like a clinician now. So, so you are, that's right. I do the same thing. So that's wonderful. As we'll be coming to a wrap here, Dr. Pennebaker, are there any thoughts about medicine and in the world of pain, chronic pain? Are there any other thoughts, or you think, as far as studies, you think you might like to see your work go into? What do you think we need to do more of, from your perspective as a scientist? I mean, what do you think we need to do? It's a broad question.
It's a really broad question. What's so interesting is just the way science works. Historically, in the last 30 or 40 or 50 years, certainly in psychology,
Mhm.
The way therapy has moved forward it's been very difficult because so much of it has been based on questionnaires and self-reports. And and when people are in these studies that are time consuming, they are biased to say that it really helps.
Mm.
And very few of these studies actually look to see if it makes any difference. So that, somebody comes in and they're afraid of heights, and they go through all of this training to make them so they're not afraid of heights. And that's great, but nobody ever goes to see, do they now drive over that high bridge? And it turns out they probably don't, but they say that the therapy helps. My sense is we need to keep experimenting, trying new methods, trying new ways of evaluating what works. And as a therapist, my approach and as a non-therapist for me, but acting like a therapist, if I work with an individual case, I want to start off with, so I don't really care how you feel. I want to know what you're doing. What are the problems? You, you're afraid of swimming? Okay, let's try to get you to swim. Are you having problems with this? Let's see if we can get, in other words, come up with some behavioral or biological
Love
or
it.
other markers and use that as the index. If you say you still feel afraid, but you're swimming, my attitude, okay, I've done what I intended, and you go ahead and feel afraid.
I
Not my
love that.
problem. Yeah.
Y-
So
y-
it's a, I've always called it the taxpayer's perspective.
the taxpayer's perspective.
Yeah, which is, you know, the, they're historically the the more conservatives in government have been pretty contemptuous about psychology. And I think
Mhm.
one reason is so much of psychology has been based on questionnaires. Oh, my self-esteem is low. And that the Republican says, big deal, tough, get over it. Well, I'm not a Republican, but I kind of agree with that, which is show me the money.
Yeah.
If your therapy can make you go to the doctor less, make you work more, make you a better parent, make you drink less, smoke less, I'm going to pay attention.
Wow.
And if I can bring about changes in meaningful behaviors that are good for society, I think that's what we should all strive for. If your self-esteem goes up, whoop-de-doo, that's great. But that's not why I'm here. I want you to be a better human being.
Wow. I think I might be looking at myself here because that's the I love how you just put that. Listen, you might not know this, but you're not only a therapist. I'm officially dubbing you this, the honorary acceptance and commitment therapist, treatment therapist. This is what we do in ACT. In ACT, it's a behavioral, evidence-based treatment, and we teach patients. I have a saying: take your doubt, take your fear, take your emotions, acknowledge them, but put them in your pocket and keep doing.
Oh, very interesting.
Yeah, and I love that you just validated everything I'm doing. So, and coming from you, that's even great. So listen, this is fantastic, and I sincerely, I know you're a busy individual, but just taking this time this morning to be able to chat with you, and I know my patients, my viewers are very appreciative of what you have said today, and I feel this sounds ridiculous, just conversating with you, I feel a little lighter. So that there isn't so many restrictions on the do's and don't do this and don't write past 21 minutes.
Yeah.
And you can air write, you can toe write. I'm sure people will be coming up with different ways.
Mm-hmm.
But I just wanted to solemnly say one more time, just to close the circle out, is for your time, your effort, and the gift that you've actually given the world. And I'll say this till my last breath. I'm indebted to you and grateful, and thank you so much for coming on this.
Well, thank you. I'm touched by what you said, and I really appreciate what you're doing.
Great. Thank you, Dr. Pennebaker. Again, for those of you, it's a true service to have you here today. I'll catch you the next moment. I'm Dr. Les.